Hi, my name is Dr. Maheshindra Singh. I'm a consultant general and colorectal surgeon. First and foremost is understanding what cancer means. Now, cancer is a condition where there's an uncontrollable growth of cells in certain parts of your body. So where colorectal cancer is concerned, it just implies uncontrollable growth of cells lining the bowel wall. And colorectum basically just implies your large intestine, and as we know, the large intestine is the last part of our digestive tract. And our large bowel, the main functions of that is that it does absorb some amount of nutrients, but the main function is to absorb water and also to form the fecal residue, which is then expulsed out through the back passage. So colorectal cancer is a major public health concern. Now, if you look at the data compiled by the National Cancer Registry in Malaysia, compiled from 2012 to 2016, it is the second most common cancer after breast cancer. Now, looking back at the data, if you compare to the figures of statistics from the past years, apart from its rising incidence, what is more worrisome is that most patients who present to us usually with symptoms are those in advanced stages of the disease, that is stage 3 and beyond, which is why we keep implying the significance or importance of early detections and screening. So one of the most important risk factors towards colorectal cancer is advancing age. As we know, the older we get, we are subjected to all forms of ailments, and colorectal cancer is no exempt to that rule. Now, if you look at the Western data, now 90% of cancers of the colon rectum are seen in patients beyond the age of 50 years, whereas in our context, 90% of our patients are seen beyond the age of 40 years. So we do have a tendency of seeing patients in slightly younger age group. Now, apart from the age, the other risk factors implied would be environmental factors, of factors we're exposed to, and amongst which is diet as well. Now, as we know, diet or high consumption of processed meat, for instance, or overcooking of meat, barbecuing, pan frying, these are important risk factors. Or food which is lacking in dietary fiber, or fruits and vegetables have also been implied. The other independent risk factors would be things like obesity, which is known to be an independent risk factor of its own, smoking, sedentary lifestyle, and also inherent conditions of the bowel. For example, colitis, particularly ulcerative colitis, is known to be another risk factor towards development of colorectal cancer. So when should we do screening? Essentially, now again, it all boils down to what are the age category of the risk factors of the patients at risk. Now again, if you look at the Western world, most of the cancers are seen in patients beyond the age of 90 years. We see young age. So the age of screening should be from the age of 45 years above. So FIT just means fecal immunochemical test. Now what this means to say essentially is basically testing for occult blood, or FOBT. Yeah, occult blood means you're checking for blood which is not seen with the naked eye, right? Now, the good thing about FIT is compared to the conventional test kits called the GFOBT or guaic-based FOBT, you do not need to worry about restricting, your diet intake, for instance, because the guaic-based test, there are a lot of restrictions involved. You have to omit taking certain meat products at least about 5 days prior to the test, because sometimes the animal meat blood give you a false positive reading. And the other thing you have to worry about is basically also omitting certain blood thinners like aspirin, Plavix, even pain control medications have to be restricted, and even vitamin C for that matter. Whereas the FIT is a test kit where you just have to use antibodies to detect the blood test. Now it's also more specific to human globin, so it's more accurate as compared to the conventional guaic-based FOBT. Now, regards to sensitivity of the test. Now, if you look at colonoscopic ways of assessing or diagnosing colorectal cancer, the sensitivities can be as high as 95%, whereas the fecal or FIT test sensitivity amounts to about 75%. So this is a study that is, with the main initiation of looking at the feasibility and accessibility of using fecal immunochemical testing for detection of colorectal cancer in a private practice setting. Right, this is the very, very first private practice-based test which is being conducted. So the main objectives here is basically to assess the sensitivity of FIT in detecting colorectal cancer and also adenomatous polyps. And apart from that, it also is the secondary objectives will be in terms of assessing the compliance rate of patients in terms of how compliant are they to come forward for a colonoscopy following a positive result in an FIT test, and also in terms of looking in terms of adenoma rates, detection rates, and also the complication rates of colonoscopy. These are some of the variables that we'll be looking in doing this test. Now, the biggest challenges when it comes to do this test is, which applies to anywhere where we do advocate screening using a fecal blood testing, is always the compliance. Patients are always resistant in terms of coming forward when it comes to conditions like where you have to give your stool sample for assessment, for instance. So compliance is always a big thing, which is why we keep using all forms of media and all forms of advocates in terms of advocating the importance of coming forward for screening. Colorectal cancer is a major public health concern. Now, screening for colorectal cancer saves lives. If you are 45 years above and are asymptomatic, you need to have a screening test done. This can be in the form of a colonoscopy, or you can have a fecal immunochemical test kit. Now, this explains everything here. We have a screening program that's been conducted, and please have it done at the earliest. Thank you.